Definition of hernia. Protrusion of viscus or part of viscus through the wall containing it. Parts of hernia. Hernial sac, content, defect hernial orifice. Types of hernia. Uncomplicated, complicated, obstructive hernia, strangulated hernia. Features of uncomplicated hernia. Reducible, cough impulse present. Features of complicated, obstructive hernia. Irreducible, cough impulse absent, intact blood supply. Features of complicated, strangulated hernia. Obstructive hernia plus compromised blood supply. Overlying skin inflamed. The process of reduction of hernia is called taxis. Taxis is contraindicated in, and why? In obstructive and strangulated hernia cause it leads to reduction en masse, reduction of content plus ring. Hernia of omentum is called omentocele. Hernia of bowel is called enterocele. Hernia of appendix is called Amyans hernia. Hernia of Meckel's diverticulum is called Latreille's hernia. Among enterocele and omentocele, which one has doughy consistency? Omentocele. Reducibility in enterocele and omentocele. Omentocele, easy to reduce first part. Enterocele, difficult to reduce first part but second part easy. How to differentiate among enterocele and omentocele. Peristalsis, bowel sounds, and tympanic note are related to enterocele. Opposite seen in omentocele. Types of hernia surgery. Herniotomy, herniorrhaphy, hernioplasty. Steps of herniotomy. Identify the sac, open the sac, put contents down, cut excess sac, close the sac, leave the defect intact. Disadvantages of herniotomy. Highest recurrence rates. Herniotomy is surgery of choice in 1. Congenital inguinal hernia. 2. Congenital hydrocele. 3. Inguinal hernia in kids. Because of high muscle tone, defect closes spontaneously in kids. Herniorrhaphy procedure. Herniotomy plus suturing the two ends of defect together. Indications for herniorrhaphy. 1. Infected hernia. 2. Strangulated hernia, cause in these cases synthetic mesh cannot be used. Hernioplasty procedure. Herniotomy plus mesh placed over defect. Most preferred, least recurrence rate. Examples of synthetic hernia mesh. Proline, Vicryl plus proline. PTFE, polytetrafluoroethylene. Examples of biological hernia mesh. Acellular human dermis, alloderm. Acellular porcine dermis. Which among the following mesh don't need sutures? Fenestrated, solid. Fenestrated, cause fibrous growth occurs through holes and anchors the mesh at place. Example of hydrophobic hernia mesh material. Proline. Example of hydrophilic hernia mesh material. Polyester. Which hernia mesh material does not adhere to bowel inside peritoneal cavity? PTFE. Ideally the mesh should cover how many cm in all direction around hernial defect? 5 cm cause mesh shrink. Features of ideal hernia mesh. Low weight, thin fibers, large pore. How much weight is considered low or high weight for hernia mesh? Low weight less than 40 gm per square meter. High weight greater than 80 gm per square meter. Complications of plug mesh. Meshoma formation due to excessive collagen deposition can lead to pain due to nerve entrapment. Overall most common hernia. Inguinal hernia. Most common hernia in males and females. Indirect inguinal hernia. Internal inguinal ring is modification of fascia transversalis. External inguinal ring is modification of external oblique aponeurosis. What's direct inguinal hernia? When hernia occurs through Hesselbach triangle. What's indirect inguinal hernia? When hernia occurs lateral to Hesselbach triangle or through deep inguinal ring. Boundaries of Hesselbach triangle. Inferior epigastric vessels. Inguinal ligament. Rectus abdominis outer border. Superior and inferior boundary of myopectineal orifice of Frouchard. Superior, arching fiber of internal oblique. Inferior, pectineal ligament. Medial and lateral boundary of myopectineal orifice of Frouchard. Medial, rectus abdominis. Lateral, iliopsoas tendon. Significance of myopectineal orifice of Frouchard. It covers defect of inguinal, femoral and obturator hernia. Clinical examination of hernia. 1. Position standing and lying down. 2. Appreciate cough impulse. 3. Assess abdominal muscle tone. 4. Complete versus incomplete hernia. Difference between position of inguinal and femoral hernia. Inguinal, above and medial to pubic tubercle. Femoral, below and lateral to pubic tubercle. When the hernial sac is present midway between deep and superficial inguinal ring, it's called bubonocele. When the hernial sac just crossed superficial inguinal ring, it's called funicular. When the hernial sac just crossed superficial inguinal ring and reaches scrotum, it's called inguinoscrotal complete. Clinical tests to examine inguinal hernia and which is the best. 1. Deep ring occlusion test best. 2. Ring invagination test. 3. Zeeman 3-finger test. Ring invagination test for inguinal hernia. Little finger placed in superficial ring through scrotum. If it touches tip of finger, indirect. Touches pulp of finger, direct hernia. Zeeman 3-finger test for inguinal hernia. 1 finger each at superficial, deep, femoral ring. Check which finger lifts when patient coughs. Investigation for inguinal hernia. USG. Indications. Doubtful diagnosis or non-palpable hernia. Types of repairs in herniorrhaphy. 1. Bassini. 2. Scholdes 3/6 layer repair. Bassini repair procedure. Reflected portion of inguinal ligament sutured with conjoined tendon. Scholdes repair. First layer double breasting of fascia transversalis. Second layer double breasting of inguinal ligament with conjoined tendon. Third layer, double breasting of external oblique aponeurosis. Complications of open inguinal hernia surgery. Hemorrhage, injury to vas cord structure. Nerve injury, entrapment, chronic inguinal pain, recurrence, wound infection. Most common nerve to be injured in open inguinal hernia surgery. Ilioinguinal nerve. Most common nerve to be entrapped in open inguinal hernia surgery. Iliohypogastric nerve. Why does chronic inguinal pain occur as complication in open inguinal hernia surgery? It's due to nerve entrapment beneath mesh. Indications for laparoscopic inguinal hernia surgery. 1. Can be done in all cases. 2. Bilateral inguinal hernia. 3. Recurrent inguinal hernia. Types of laparoscopic inguinal hernia surgery. 1. TEP total extraperitoneal repair. 2. TAP transabdominal preperitoneal repair. Peritoneum, space, advantage and disadvantages of TEP. Peritoneum intact, extraperitoneal space created, technically better, more demanding. Peritoneum, space, advantage and disadvantages of TAP. Peritoneum breached, preperitoneal space created, less demanding. What's stop-as repair? Open preperitoneal repair, mesh held in place due to pressure. Used in recurrent inguinal hernia. Boundaries of triangle of doom. Medial, vas deferens, lateral testicular vessels. Inferior, peritoneal reflection. Boundaries of triangle of pain. Medial, testicular vessels. Lateral, peritoneal reflection. Superior, iliopubic tract. Content of triangle of doom. 1. External iliac artery. 2. External iliac vein. 3. Genitofemoral nerve, genitals branch. Content of triangle of pain. 1. Lateral cutaneous nerve of thigh. 2. Femoral nerve. 3. Genitofemoral nerve, femoral branch. Complication related to the triangle of doom. Bleeding if stapler applied. Complication related to the triangle of pain. Meralgia paresthetica, shooting pain along lateral thigh due to entrapment of lateral cutaneous nerve of thigh. Trapezoid of danger. Triangle of doom medially and triangle of pain laterally. What's corona mortis? AKA circle of death. It's aberrant obturator artery, which connect inferior epigastric artery, branch of external iliac, and obturator artery, branch of internal iliac. Complication associated with corona mortis. It lies just behind pubic tubercle and if injured causes torrential bleeding. Classification system for inguinal hernia. EHC European Hernia Society classification. EHC system grading. Grade 0 no hernia detected. Grade 1 1 finger breadth. Grade 2 2 FB. Grade 3 3 FB. 1 FB equals 1.5 centimeters. L equals indirect hernia lateral. M equals direct hernia medial. F equals femoral hernia. What's Gibbon's hernia? Inguinal hernia plus hydrocele. What's pantaloon hernia? Direct plus indirect hernia component. Common in elderly. What's sliding hernia? When posterior boundary of hernia sac is a visceral structure and hence can be easily injured while separating the sac. Sliding hernia is also called as hernia en glissade. Most common structure for sliding hernia. Sigmoid colon greater than bladder. Left greater than right. What's sportsman hernia? When hernia sac is extremely small and hence not pollable in examination. It occurs due to tear in posterior wall muscle and causes pain. Sportsman hernia is also called as Gilmore's groin. IOC for sportsman hernia. MRI.